Good afternoon, and thank you everybody for joining the last action period call for our Injury Prevention Plus Safe Environment for Every Kid, or SEEK program. This is action period call 7 of 7 of Wave 5. Very thankful for all the hard work you've put into this wave, and thank you for being here. And always, thank you to our program partner, the Ohio Department of Health, the Violence and Injury Prevention Section, or VIPS. So welcome everybody. If you can do so, just like old times, please put your name and practice in the chat. We welcome you here. We will hear from Zainab one last time on the aggregate data review. And then we have a special guest today, Stephen M. Dunn from Project Dawn, and he will be reviewing Project Dawn and community harm reduction. I did not update this slide. We know that you're going to swim or not this summer. You can put maybe something else fun that you were going to do this summer in the chat. Okay, Zainab, you're up.
Thanks, Brooke. So like Brooke said, I wanted to thank everybody for, finishing off strong. We understand that there can be a little bit of a pressure or an additional stress with submitting this data. So we really do appreciate it. We just want to let you know, this is, for your practice and for your patients and to kind of improve your patients' quality of life. So we appreciate it. And we're sure that, you've learned a lot from this project, and we hope to see you continue to incorporate some of this work in the future. But for right now, we have the data that everyone has submitted up until last week. We know that the data is collected live, so hopefully if anyone has any data or has collected data like in paper form, they've let Brooke know. But everything you're seeing now is current as of last week. I'm ready for the first slide, Brooke. So again, as you know, we're collecting measures on 5 different topics: social needs, family needs, home safety, safe sleep, and car seat safety. And so the first umbrella topic that we have again is social needs, asking about whether or not the household or the primary caregiver needs help with um, finding daycare for their child and stuff like that. So those are the social needs questions. We're having 100% in terms of screening. Everyone that's given the survey is completing all the questions in the survey in terms of counseling. We do have one or two patients that were not counseled on some of their social needs, but we're still very close to that 90 to 100% throughout QI. Next slide, please. The next one is family needs. This includes questions like if the primary caregiver is struggling to take care of their child, if the mom is struggling with depression, and questions of that sort. So those are the family needs questions. Again, we're seeing 100% screening. So everyone that's receiving the survey is completing all the family needs questions in the survey. And in terms of counseling, here we are seeing a little bit of an up and down throughout QI, but again, we're still hovering at that 96%, 100%, 95 to 100 throughout QI. We did see a little bit of a dip in March, but that number did go back up, and it's at 100% in May. Next slide, please. Home safety. This topic really takes up the largest chunk of the questions in the survey. These are questions like if you have the number for poison control, if the primary caregiver or someone in the household has CPR training, if the furniture is secured to the wall. Again, this is, like I said, the biggest chunk of the survey. And so this is where you will see a little bit of lower numbers in terms of counseling. But again, you're still performing very excellent. In April and May, we are between 85% and 96%, which is consistent with what we've seen. And again, I just want to thank everybody that for doing a great job. Again, if you're continuing to give your patients the resource sheet that we've provided or any resources that you have that have any information on home safety, then that's considered counseling as well, even if you continue to distribute those even after our project. Next slide, please. The car seat safety is, again, as for both age groups, we're seeing 100% screening. We are seeing a little bit of lower counseling, and this could be to the fact that one question asks if what direction the seat is facing, and then also if the seat has been checked by a nurse, a firefighter, or some expert. So that's really why we're seeing a lot of need in this specific topic. Again, if you're providing your families with any resources regarding installation or proper installation of car seats, that is considered counseling. But we are seeing a little bit of lower numbers for the older age group here, um, but um, still performing pretty well. We did see increase from March. We did see a dip in March for the older age group, and then we saw a dip in April for the younger age group. But we did see both of those numbers spike up a little bit in May. Next slide, please. And finally, safe sleep. Safe sleep is only asked for the younger age group. This asks questions like if there are like objects in the crib with the child, if the child has um, a safe space to sleep alone that's apart from the parent's bed. Again, 100% of the families that are answering this portion of the survey are answering all of the safe sleep questions. And again, we are seeing a little bit of an up and down here, but it's usually consistently over 80% of patients that are indicating a need are being counseled. Next slide, please. This is the screening tool completion rate. So this is kind of like the first um, little graph that you were seeing in the previous slides. So everyone that's receiving the screening tool is answering all the questions or over 98% of the questions in the screening tool. Next slide, please. And this is resources provided. I know that we give you the option to either provide our resources or resources that you have. And I've seen in the data that it's not necessary that you're giving only AAP resources. So again, thank you for that. But we are seeing very high numbers here. We've seen consistently high numbers, over 90% throughout QI of resources provided. Next slide, please. So from this slide moving forward was the additional part that we added to the SEEK survey compared to previous waves. And so you're going to see slides that really are looking at two different kinds of measures. This one and the next one are looking at all of the needs. We're not looking at families specifically, but we're looking at all of the needs that were indicated by the families. And so we're seeing most of the family, 98%, 99%. You can even see that the orange part is almost not visible in May. But we're seeing over 99% of families saying that they plan to make a change, and less than 1% is saying that they do not plan to make a change. This is, again, specific to the needs. These are not specific to the families. So the family can have 3 needs, 1 social need, 1 family need, and 1 home safety need. And then they can indicate that they plan to make a change in 2 of those 3. So this is looking at specific needs by the families. Next slide, please. Likelihood of change. So we have a sort of a Likert scale in terms of how likely they are to make a change for the needs that they've indicated and for the counseling that we've provided. We have ready to make a change, seriously considering changing, thinking about changing, and no thought of changing. Again, in our previous slide, we saw that one of those needs, the person said or the family said that they do not plan to make a change, and we can see that here in no thought of changing. But the majority are saying that they're ready to make a change or seriously considering making a change. We are seeing a little bit of a high number this month for those that are just thinking about changing in the gray portion of the column. But overall, they have some intention to change at least. Next slide, please. And finally, this slide is looking at the families in general. They're not looking at specific needs. So if we're looking at the example that I gave just a few slides back about the family that had 3 needs in 3 different topics, if they are indicating that they are planning to make a change in at least one of those, uh, then that's considered that that family is willing to make a change in general. So again, here we're looking at the family. We're not looking at specific needs. And 100% of the families are saying that they are willing to make a change in at least one of the needs that they indicated that they had counseling on. I hope that this information was beneficial to you. I know that Brooke sends out data, I think on Fridays. Hopefully, I'll get your individual data to her this week, so she can send it out to you. But again, this is aggregate data for all the participating practices. If anyone has any questions, you can put them in the chat or take yourself off mute. And if anything else comes up later, please don't hesitate to ask. But if not, I can hand it back over to Brooke.
Thanks, Zainab. Yeah, any questions for her? Yeah, of course, after the program wraps and well into the summer, we can still have communication. Any questions that you have around sustainability or anything like that, we can continue to talk about that. But any questions for Zainab on the aggregate? Hearing none. Zainab, thanks so much.
Thank you.
Okay, Stephen, I can stop share.
Okay, great. Let me share my screen. Can you see the presentation?
Looks good, thanks.
Great, wonderful. Thank you so much for having me. I am very excited to be here. My name is Stephen Dunn, and I'm one of the public health consultants for the Community Harm Reduction Program here at the Ohio Department of Health. And today I want to talk a little bit about Project Dawn and community harm reduction, which is a resource for all of our communities. So I want to start this by going into some of the statistics about what is happening in Ohio, specifically overdose deaths. So as you can see, here we have the age-adjusted rate for unintentional drug overdose deaths. This is from 2020 to 2022, which is the last full year of data that we have. As you look at this map, you can see the lower portion at the bottom of the state has some of the highest rates of overdose deaths in Ohio. Scioto County, which has been pretty much the leader in this for the past few years, you can see is number one with 134.8 overdoses. And then you see Jackson, Meigs County, Vinton County, all of those kind of counties in the bottom there are pretty high for when it comes to overdose rates. And then you can kind of look around the state and you see other pockets of dark blue. Those are programs that have had anywhere from 58 to over 100 overdose deaths. And as you can see, there are quite a few. So this is part of the problem that we face in Ohio and as a program. Now, some good news is that unintentional drug overdose deaths fell 5% in 2022 compared to 2021. We had 5,174 deaths as opposed to 4,951 in 2022. So a little bit of good news there. Illicit fentanyl or fentanyl analogs were involved in about 81% of unintentional drug overdose deaths. And this was usually in combination with other drugs. So you would see fentanyl with cocaine or methamphetamines, etc. Now, from 2021 to 2022, unintentional drug overdose deaths involving stimulant drug categories had the largest increases. And that's where we started to see in 2022, Black non-Hispanic males continued to have the highest rate of unintentional drug overdose in Ohio compared with other sex and race ethnicity groups. We often find that Black non-Hispanic males and females are tending to do more stimulant drug categories like cocaine, and now finding fentanyl in their drug supply is why we believe that we're starting to see a rise in that community. Now, overdose deaths impact many types of people. It doesn't matter about your age, your race, ethnicity, gender, or social statuses. So it really does affect the entire population in Ohio. Now I want to get into a little bit about what harm reduction is and what naloxone is and how that kind of changes things for us. Now, harm reduction focuses on ways to minimize negative health impacts that are associated with various behaviors. It's most commonly applied to those infectious diseases and substance uses. For substance use, harm reduction helps prevent overdose deaths. It reduces the transmission of infectious diseases, provides comprehensive care to individuals in need, and serves as a pathway to treatment if that's a possibility. Now, naloxone is one of the many harm reduction strategies because it can prevent deaths due to accidental overdose. So we kind of want to jump in front of the program and make sure that we're able to revive people who might go into overdose, which is why having naloxone spread widely across Ohio has been really effective in getting that 5% drop that we saw at the beginning of the presentation. Now, naloxone, you can see the photo there. That's what the Narcan name brand nasal spray looks like. It's a medication drug that can reverse an overdose caused by an opioid drug. Now, the medication tends to block the effects of opioids on the brain and restores breathing to the individual. It's a safe, non-controlled drug, and it has no potential for abuse. This is something we really like to let people know, especially when we start talking about having naloxone in schools or in places where it is easily accessible. As long as we did not have opioids in our system, we could spray naloxone into our noses. For hours, we'd probably have a headache, but that's about it. Now, due to the presence of fentanyl in the drug supply, it's really recommended that naloxone also be given during non-opioid overdoses. As we saw from that earlier slide, fentanyl has made its way into most drug supplies in Ohio. So even if somebody doesn't think that there's an opioid in their drug supply, we recommend, if they are unresponsive, that you are providing them with naloxone. Now, this can be administered by almost anyone, family, friends, bystanders. It really is something that we recommend everybody have as part of their first aid kit. I personally carry a dose of naloxone with me when I go out because you just never know where an overdose may happen, and you could be the person that saves somebody's life. Now, every Project Dawn program that provides naloxone has training that is available for free. They will go through how to administer, how to perform rescue breathing, how to put somebody into the recovery position, and most importantly, calling 911. That is the thing that we really want people to do because an overdose can last up to 3 hours. So we want to make sure that emergency services are there and they are taking care of the patient and providing them with follow-up care. Now, if you're ever concerned, what if I administer naloxone? Could I get in trouble for that? Absolutely not. Because luckily, we have a Good Samaritan law that grants immunity from civil liability for any damages that may arise from providing naloxone to somebody who is potentially overdosing. Now, immunity is granted for minor drug possession offenses or drug paraphernalia offenses for the person who is overdosing, as well as the person who is administering the naloxone and called 911. There are limitations to that, and we do want to make sure that you're aware. The Good Samaritan law can only be invoked twice. So if you're talking to people about that, we want to make sure that you're aware that that could be a limitation for some people. The great thing is previously, before 2023, the Good Samaritan law was only able to be used by people who were not on parole or probation. But thanks to House Bill 558, that was removed, and now those people can be covered as well. So I want to let you know a little bit about Project Dawn. So Project Dawn, the Dawn actually stands for Deaths Avoided with Naloxone. And we are a network of opioid overdose education and naloxone and fentanyl test strip distribution programs that we at the Ohio Department of Health coordinate. Now, Project Dawn was actually named after an individual who had unfortunately passed away from a witness drug overdose. Her name was Leslie Dawn Cooper. And when that happened, her family and friends said that they felt helpless and didn't really know what to do in this situation. So the very first Project Dawn program was actually started in Scioto County, which was Leslie's hometown. So that's where the name of Project Dawn comes for. Now, since that one program, we have grown and we now have more than 200 organizations that operate over 800 naloxone distribution sites within the state. And we have coverage thanks to mail order programs in all 88 counties. So really a significant amount of growth since 2016. Now, many Project Dawn programs operate multiple sites, usually partnering with agencies and local businesses. And this is where we have found the most success. I always say that the most successful Project Dawn programs are the ones that work with agencies that are already doing good work in their communities. So they will find an organization, if they want to reach out to homeless populations, they will find organizations that are working with those populations and kind of ask them, hey, while you're out there working with them, could you, provide them with naloxone if needed? What this does is it allows the agency to not have to disrupt their own work hours, because as we all know, not every problem ends at 5 p.m. or ends on Friday. And so a lot of these organizations work with people in the evenings, on the weekends. So why reinvent the wheel if somebody else is already doing that kind of great work? So it really allows our Project Dawn programs to get their hands out into the community, far reaching through their programs and the partnerships that they have. And it also helps if there are populations that deal with like stigma or fear of a new organization. That trust bond has already been built. So why not kind of keep building on those people? So that's where we have found the most success for our Project Dawn programs. Now, some of these partnerships and settings can include some street outreach, online mail order, like I talked about earlier, churches and faith-based organizations, health departments, syringe service programs, community grassroots organizations, emergency departments, mobile units, and of course, public businesses like restaurants, bars, hotels, and gas stations. Those are locations where, we will have naloxone on the premises. Because you never know what's going to happen. And so it's great to have naloxone there in case someone were to overdose, especially in our hotels and motels. Usually there's only one person, kind of at the counter. So making sure that naloxone is available through our emergency access units has been really successful for us in lowering the risk of overdose. Now, Project Dawn programs provide overdose education and naloxone distribution training. They also provide the naloxone kits and fentanyl test strips to the public free of charge. The photo on the right-hand side of your screen, you can see those are our fentanyl test strips, which are by the BTNX name brand. And then that's a picture of our Project Dawn kit. You have a face shield, which helps with rescue breathing, black nitrile gloves, the pouch itself, and then all of that fits with the Narcan or whichever brand of naloxone you're using will fit inside that pouch. So it's easy to kind of travel with, throw in your purse, throw in your bag, just something to kind of have on your person. Now, when you receive training, you can receive training on recognizing what the signs and symptoms of an overdose look like, how to call emergency medical services, administering the naloxone to somebody else, rescue breathing, and placing someone in the recovery position, and then, of course, monitoring that person until EMS arrives with additional medical services. Now, just to give you guys a little information when it comes to distribution by county in Ohio, in 2023, Project Dawn programs distributed 296,495 naloxone units, which is absolutely amazing. The most that we have distributed in terms of years thus far. Now, since 2014, Project Dawn programs have distributed 851,734 naloxone kits. We've trained over 482,000 people to administer naloxone, and we have reported over 89,200 overdose reversals. which we are really proud about. And I have to tell you that number is actually very small compared to what we believe it is, because the only way that we get overdose reversals reported to us is if somebody comes back to the program and says, hey, you know that naloxone kit I got? Well, I used it on somebody and they survived. We're trying better to capture that information with a new QR code that's placed on our naloxone stickers, where people can self-report that they administered naloxone and that person survived. But yeah, just really proud of those numbers. It's great to see. The darkest areas in blue on that map are the number of programs that have distributed over 15,000 naloxone kits. And you see Franklin County is on there, as well as Cuyahoga, which has Cleveland, and Lucas County, which of course has Toledo. But we're really proud of all of our programs for distributing naloxone and really increasing the amount of visibility across the state of Ohio. So this is kind of our tagline: carry naloxone and save a life. That really says it, doesn't it? We decided to make it easier for people that are looking for Project Dawn programs, because even though we've been around since 2014, it's been very hard, to get that name recognizability to all of the people of Ohio. So we created a website in conjunction with our partners at the Department of Mental Health and Addiction Services and Recovery Ohio to create naloxone.ohio.gov. And this is a website for organizations, businesses, first responders, and general public who don't really know how to get naloxone within their community. Or maybe they live in an area where there isn't a Project Dawn program in their county. So what they can do is they can go to this website, they can request naloxone, they can watch our video that was recently created. It's about 1 minute and 2 seconds on how to recognize signs and symptoms, how to administer naloxone, how to put someone in the recovery position, all those kinds of good things. They can also get resources for finding treatment centers, crisis counseling hotlines. There's a lot of great information on this website. So I also encourage all of you to check it out after we're done today. So what this does, it provides anybody who's looking for it a simplified process of accessing naloxone. And this, the requests come to us at ODH. We will find a local program that can help them. Once we make that connection, then that person now knows, oh, this is the program in my county that I can go to whenever I need assistance, whenever I need naloxone. So it's a great way to kind of get people together and let them know the ways that they can get the resources that they need to keep them, their friends, and family safe. Now, are you interested in becoming a Project Dawn program? If you are, we would be so excited to welcome you and your agency to our network. You can register as a Project Dawn program if your organization will distribute take-home naloxone kits free of charge. That also means you can't charge insurance. If you're a local health department that would like to equip law enforcement and first responders with naloxone for in-field use, you can also become a Project Dawn program. One thing that we want to make sure that people are aware of is that you should not register as a Project Dawn program if you're an individual and need that naloxone for personal use, or your desire is to keep naloxone on the premises of your establishment in case a suspected overdose occurs, which is a wonderful thing. But what we can do is partner you up with a local Project Dawn program to provide you with that type of naloxone. And finally, your organization does not intend to distribute naloxone on a consistent basis. So if you're, say your agency wants to do a special event for Overdose Awareness Day, which is coming up on August 31st. We also have September's Recovery Month. So say, your organization wanted to do a special event. What we would do is partner you with an existing program, and they would provide you, with however many kits you think you would want to distribute for said event. And then that way you can distribute what you need, but it doesn't necessarily mean that you would become a Project Dawn program. We do have a link. Of course, these slides will be sent, I'm sure, after our presentation, so that way you can access any of those links. but there is some information on how to register as a Project On program on our website. So really the main takeaways from the presentation that I would like you all to have is that overdose deaths in Ohio do continue to increase. Even though we did have that 5% drop in 2022, 2023, 2024, those numbers aren't finalized yet, obviously. But as they do, we'll see, if that is kind of a consistent drop or if things are starting to increase again. Naloxone is a safe medication that saves lives. Project On programs support, train, educate, and promote harm reduction. And anybody can be trained to administer naloxone. And this last one is kind of my favorite motto. Anytime naloxone is provided to somebody who is overdosing, that person has a chance to celebrate another birthday. We talk a lot about data and statistics and, how programs operate and this, that, and the other. But really, our job is to keep people alive. And there's no judgment with it. Hopefully, people will find ways into treatment. But if they don't, we want to make sure that they have the tools to know what is in their drug supply and stay alive. That's really what we care about. And that's what we believe people in public health care about is keeping our citizens alive. So if you would like to get connected with us, we have several QR codes that are here on the screen. That first one takes you to our Project On website, where we have all kinds of wonderful information for not only the general public, but also our Project On programs, as well as interactive maps. So you can find syringe service programs, you can find Project On websites, and you can even find emergency access naloxone through our cabinets and nalox boxes that are all over Ohio, including all of the rest stops in Ohio. The governor tasked the Department of Transportation to put emergency naloxone cabinets in all of the rest stops across Ohio, which I think are about 73 of them. So if you ever stop at a rest stop, you'll see in the men's and women's restroom an emergency naloxone cabinet. So really excited. That not only protects people in Ohio, but people that might be visiting Ohio as well. The second QR code will take you to a list of our distribution sites. So if you're wondering if your city, your county has a Project On program or a distribution site, you'll be able to find it there. If you are interested in registering as a Project On program, that third QR code will take you to our registration page. It'll walk you through the whole process. It's relatively easy. And if you do end up doing that, there is a wonderful new program orientation course that is held that is actually led by me. So you'd get to talk to me again. And how wonderful would that be? And then finally, that last QR code is a direct way to email us to ask any questions that you may have, follow up on today's presentation, etc. So I've left this up on the screen for just a couple more seconds in case anybody wanted to capture anything. But again, these slides will be sent to everybody so you can review that later. And then finally, here is my contact information. Again, stephen.dunn@odh.ohio.gov. That is my number. I'm a program consultant. I deal with not only our grantees and our contractors, but also Project On programs all over the northeastern section of the state. I also help out with some southeastern programs as we're trying to fill our team all the way up. But if you have any additional inquiries, you can reach out to our main email, which is projecton@odh.ohio.gov, or you can go to our website. The link is there. And then there are some other resources, including the naloxone.ohio.gov website that we talked about. We also have our OH Against OD campaign, which is really exciting. It's a great campaign all about harm reduction, letting people know what's happening in the state of Ohio. There's a lot of great resources there that you can download. There's a lot of great videos that can be shared. There's even influencer ads. So if people, want to get on social media and promote this program, they absolutely can do that. So it's a really great site. I highly suggest that you all take a moment to check out. And at this time, I will open it up for any questions. And actually, I'll escape out of here and go back and stop sharing my screen. Uh, so that way we
Stephen,
can see
thanks
each
so
other.
much.
Absolutely. Thank you.
Does anybody have any questions for Stephen? I did not know that every rest area in Ohio had a supply.
Yeah, that was really exciting. We started talking about that at the end of last year, and then the governor and Recovery Ohio tasked ODOT with doing that. So they made really quick work of it. So really exciting. I actually, in the process of doing site visits, so I'm traveling a lot. So I've stopped at several rest stops just to make sure that they're there and just to kind of see them, and it just fills my heart with joy because it's an amazing progressive thing for Ohio to do is to have that available to anybody that comes through our area.
Yeah. Do you know if Ohio was on the leading edge or one of the first states to kind of focus on this and create spread?
Yeah, we've definitely been recognized nationally for the work that we've done, the numbers, especially of naloxone that we distribute. So yeah, Ohio is definitely has been leading the charge, and a lot of other areas have kind of looked at us to say like, oh, what are they doing in Ohio? Unfortunately, we are high in the nation for the amount of overdose deaths, but we're really trying to work on that and to see that 5% drop in 2022. Like even though, sometimes people say 5% isn't enough, and we agree, but it's kind of an indication that the things that we're doing are working. And the more naloxone we get out there, the more fentanyl test strips that we get out there, so people can test their drugs before they ingest them to kind of prevent that overdose from even happening. Is where I think we're going to make the most progress as a state.
Yeah, absolutely. We kind of don't know what the mix is these days coming off the street, right?
Yeah, and it's just kind of everywhere. And there are some wonderful organizations like Harm Reduction Ohio, the SOAR Initiative, which are a couple of our Project On programs that actually send out batch alerts. So if you sign up for their programs, you'll be, you know, notified if there's something that they have noticed, by people kind of reporting it, like, hey, there's a really bad batch in, this part of Ohio. It just kind of lets people know, or if there's a surge of overdoses in your community, like kind of lets you know, whoa, something's going on here. So we're very thankful to organizations like that that are able to provide that information real time.
Yeah, that's a big deal. It like
Absolutely.
recalls. My mind goes to recalls. It's really good to know that as soon as you can.
Yeah, exactly.
Um, as a pediatric provider, and we have a good representation of providers around the state for this wave of the program, very thankful. Some include
Yeah.
Northern Ohio and Southern Ohio. I'm curious to know if anyone wants to talk on their personal experience with Narcan, or if anyone keeps it in stock, if anyone wants to share. But what advice would you give to pediatric providers? So pediatrics can be seen, 18 plus,
Mhm.
but I'm sure you see all ages may be involved in this.
Yeah, we really don't have any age stipulations for who can get naloxone, which is a great thing. We also find that a lot of kids are looking out for parents that may be involved in substance use disorder, and don't always have somebody that they can ask. Obviously, not all schools in Ohio are on board with having naloxone on the premises. So if they have somebody, like a doctor, a nurse that they feel comfortable with and say, hey, like this is something that I'm noticing with my parents. Is there something that I could have to kind of help me in case something were to happen? Most kids are taught how to call 911 at a super early age. So this is just kind of like another benefit for doing that. And of course, there are instructions on each box of naloxone on how to do it. But yeah, I think it's, as we're starting to see, I think we've all seen in the news images or videos of parents that are, passed out in their cars due to opioid overdoses and kids in the back. So being able to have those kind of frank conversations. I know when I was growing up, I was always told, if you can't trust talking to your mom or a teacher, talk to your doctor. And so like that trust relationship has been built over, a period of time of seeing that person on a routine basis. Sometimes, getting jabbed with immunizations and things that you don't necessarily want to deal with. But having that trust bond and having the ability to have those conversations, I think would be valuable. So I would encourage as many pediatricians that are available to have naloxone, to have an extra supply in their office in case somebody asks for it. We definitely encourage that.
Very good. Any questions for Stephen or anything to share? Okay, hearing none, Stephen, thank you so much again, and I will be sending out your slides, and hopefully our participating providers will contact you in the program for more information and hopefully become more active. So thank you.
Yeah, absolutely. And I'll just say, if anybody does have any questions, or you maybe don't feel comfortable to talk about it here, please reach out to me. Talking to new programs or potential people that want to have naloxone on hand is a passion of mine. Keeping people alive in our community is definitely the reason that I do what I do. So I'm more than happy to talk to anybody at any time. So thank you for the opportunity today. I appreciate it.
Thank you. Thank you for being a great connection.
Thank you.
Okay, just one final slide talking about program wrap up. So this is just kind of the messaging that's been going out over the last month or so. So if you have any outstanding items, or if you are not sure if you have any outstanding items, please let me know by Friday. Happy to pull that information and work with you on getting those in. And then if you are finding your supply of sleep sacks or safe sleep board books a little low, this is the last week that I can send those out for you. So please let me know if you need any more tangible resources. But with that, we can give you some time back. Stephen, thanks again. And thank you everybody for attending. And kind of globally, thank you everybody for your participation in making Wave 5 of Seek very impactful wave. And I will be in touch with more information around sustainability and kind of the future of Seek in the future. So thank you all.
Thank you.